I want to start by saying thank you. In March of this year, things changed, perhaps for good. 2020 will certainly be a year we'll never forget. Thanks to all of my Bridgewater colleagues, the patients and families for whom we're responsible have been safe and well cared for and will continue to be. Last year at our AGM, there was a particular focus on relationships and partnerships and the need to develop and build on the work done by all of us to maintain the profile of community services and to highlight the difference that they make to thousands of lives every day. Relationships and partnerships are key to our response to this pandemic. We find ourselves working more closely than ever with our colleagues in primary care, within hospitals, local authorities, and the third sector, providing care to patients at home or close to home, some of whom only days previously would have been receiving care in a hospital setting. Right at the beginning of the pandemic, many of our clinical colleagues supported the work of local integrated discharge teams. Working closely with colleagues in local hospitals and social care, they supported the assessment and discharge of patients back home or to other community settings, helped by our brilliant community equipment teams. Their compassion and commitment to their patients was commended by colleagues across the health and social care system, and I'd also like to thank them for the timeliness of their response in extremely challenging circumstances. Many of our colleagues found themselves thrust into the spotlight. Infection prevention and control suddenly found themselves at the very heart of the Trust's response. All of our colleagues ramped up their services. 7-day working became the norm for those where it previously wasn't. Our staff going into patients' homes, nursing homes, residential care homes, and goggles, visors, gloves, masks, aprons and scrubs became the new normal. It really is testament to the professionalism and resilience of all of our colleagues that they responded as they did. It would be very remiss of me at this point not to mention the work of our corporate support colleagues. Almost overnight, we went from working behind desks in our offices to working from home. New kits, systems, processes, all needed to be ordered and programmed into our daily routines. And suddenly we found ourselves working in a very different way. WebEx, Microsoft Teams, conference calls, all became tools of our communication. Staff from across our patch became adept at raising hands, posting questions, getting their cameras and speakers ready for action. Our HR colleagues supported the successful redeployment of more than 230 members of staff into new roles, clinical and non-clinical, making a huge impact and building new relationships at the same time. I'm particularly proud of the way in which our colleagues joined forces to support the resilience and well-being of our workforce at such a difficult time for many of us, with counselling, resilience training, virtual yoga, and of course the staff wellbeing outreach team. At the heart of all of our efforts was supporting our most vulnerable patients. Many were shielding at the time and in need of new and different ways of managing their conditions and the health of loved ones. E-prescriptions, video consultations, telephone calls, staying in touch safely with the people that needed our expertise the most. No one can underestimate nor wholly appreciate the enormous efforts that were made by so many in such a short period of time. What's most remarkable about all of this is that it happened in the space of just a few short weeks. In recent months, we've had to capitalise on all of this. The continued restrictions that we've all faced means we've used technology in new and innovative ways to triage, assess and treat some of our most vulnerable patients. Of course, face-to-face care will continue to be the preferred way of providing care to patients, but we have had to adapt and change our approach to protect our staff, protect our patients and their families, and continue to offer the services that they need. I really cannot thank everyone enough for their extraordinary efforts. We were helped massively by the response and support of our communities, our patients and the public at large, and we all gained strength from that. But what's proved most heartwarming has been to see just how much we're looking out for one another. checking in to see that we're okay, ready at hand with a tissue, a cup of tea, a hug or a laugh. Our response became the daily focus of our attention as we learned about the fantastic efforts of so many to care for their patients and their colleagues. Going forwards, it's my intention to harness the qualities that set apart the delivery of community-based health and care, that makes it so rewarding and such a special thing. Whilst for the purposes of our AGM, my reflections only cover the final few weeks of the year 2019-20, these are the times that we will never forget, and I shall be forever indebted to the extraordinary efforts that every Bridgewater employee made in this time, and continue to make. Our response to the pandemic sums up the spirit of Bridgewater, and is part of what sets us apart. Now more than ever before, it's my absolute privilege to serve as your Chief Executive.
At the end of March 2019, we said goodbye to staff in Health and Justice Services and St Helens. Many of the staff working in these areas have been with Bridgewater from the very outset, so I thank them all for all the work they've done to support and care for their patients. In common with organisations across the country, the early part of the summer allowed us to focus our attention on our nursing and frontline colleagues. Nurses' Day and International Day of the Midwife provided an opportunity to shine a light on these professions and highlight some of the amazing contributions they make to the health and well-being of our local populations. Nursing isn't simply about hospital wards. There are legions of men and women going into patients' homes, residential care, nursing homes and hospices. Very often they are seen as part of the family, and many of our staff have commented on the unique role community plays in people's lives and how it allows people to remain at home with their loved ones, in many cases to the end of their life. Our community dental services continue to grow in stature and reputation, and talks were initiated to bring staff from Oldham, Bury and Rochdale into the fold. This culminated in staff from Pennine Dental joining Bridgewater in September this year. Our allied health professionals were blazing a trail in their care of children and adults. At Woodview Children's Centre in Widnes, we started to see the effect of a significant review of the systems and processes that support our patient-facing clinicians. This work continues as it does in all areas of our business. In Oldham, the Right Start model, focusing on the early development of our children, started to reap real dividends, and at the end of the year, the borough was recording the most improved level of school readiness than anywhere else in the Greater Manchester region. We cannot underestimate this achievement. Investment in getting the nuts and bolts right is perhaps best demonstrated by the enormous amount of work done to bring clinical and social care teams together, a model which has been invaluable in supporting our response to the pandemic. Before I want to move on to this, I want to highlight an achievement that might have passed people by, but which gives me real hope for the future. In the summer of 2019, the first cohort of Bridgewater trainee nursing associates graduated. These individuals are now playing a vital role in our community nursing teams and are progressing on to a fully fledged nursing qualification. This makes me proud and gives me real hope for the future, because each and every one of these individuals have shown their mettle in recent months. And as a nurse of 42 years and counting, I couldn't be more proud. And so on to 2020, when the news from abroad started to send shockwaves through our nation. In February, it became clear that we, as all other NHS trusts in the country, needed to plan and get ready for what many have described as a tsunami. Unfortunately for me personally, this coincided with a significant worsening of a long-term back condition, and with a heavy heart, I had to obey medical orders and take full bed rest. I want to pay tribute to the men and women who stepped up to the plate at this point. Their support of the front line, their support of me personally, and their care of their teams was overwhelming. There were many obstacles and issues to overcome, but they remained and remain focused on doing what needs to be done. As we've heard already, the future looks far from certain, with the picture changing daily, but I feel assured that we have people who have and are making a difference, and I would like to thank each and every one of them for what they have achieved so far and will achieve, no doubt, in the future.
I would like to begin by thanking all staff for their incredible dedication and support during 1920. Throughout the year, there was continued focus across the organisation tackling those areas of high spend whilst continuing to deliver high quality, safe services. Despite the many challenges the organisation faced in 1920, I'm pleased to report that the Trust ended the year with a £50,000 surplus. This was a fantastic result and could not have been achieved without the dedication, support and hard work of all staff. I'd like to pass on my thanks to everyone, from the clinical front line right the way through to all our support staff. This has truly been a team effort. Well done and thank you. Our income in year totalled just over £109 million. The majority of our funding is provided by CCGs, NHS England and local authorities, and this accounts for over 90% of our total income. Our biggest costs are staff costs, with the majority of these costs relating to nursing, health visiting and therapy staff, as it should be. Outside of these areas, most of our non-pay expenditure is on purchasing healthcare to support our services from other NHS organisations, on drugs and on other clinical supplies. During 1920, the Trust spent over £2.3 million on capital, with replacement of expensive medical and dental equipment and the continued investment in IT schemes to support clinical services the prime expenditure. The year-on-year decrease in the Trust's total income and expenditure figures reflects the services that transferred at the start and during the financial year. These changes are consistent with the plans produced at the start of the year. With the onset of the COVID pandemic, the actual year-end process was significantly impacted. Despite new external auditors, remote working, and the start of a new year with ever-changing priorities, the Trust reported an unqualified audit opinion on both the accounts and on the value for money audit. A first. I'd like to extend my thanks to all the teams involved in this amazing achievement. This has been and remains an incredibly fast-moving, highly charged pace of working. The situation locally, regionally and nationally is changing by the day, and we need to keep on top of those changes to make sure our patients continue to receive the care they need, our staff the kit and equipment they need to keep themselves and their patients safe, and our corporate teams have access to the tools they need to support the front line. We need to continue delivering all this within the financial governance and control processes that are there to protect us all. I'd like to finish by again stressing my thanks to everyone. Your professional and dedicated approach has been and remains amazing.